It's surprisingly, when we look at a population of patients, we see doses of these novel agents that can't possibly be correct, and what we found is many patients will have a bleeding episode. And as well as I do, we'll stop the anticoagulant, we'll wait for the bleeding to resolve, and then we'll reinitiate therapy. And what we've learned recently is if you don't initiate any therapy in patients that are at risk for stroke and systemic embolism, that's a bad thing, okay? You really need to have a preventative strategy in place. What we don't have information on is should we dose reduce that original dose that may have invoked a bleeding episode to something lower. And I can tell you we don't have any information on that. And even though it seems like a prudent strategy, and now there's lower doses of all these medications available, even the lower dose of dabigatran that was not available in the United States, we have a 110 milligram capsule, that you can prescribe lower doses. Is it the right thing? The answer is we don't know. Okay, so I'm not disparaging my clinicians or physicians that I work with, but I think the question going forward is when are dose adjustments correct, and when do we need to put additional surveillance in for these patients to make sure that they're not having, thrombotic episodes or bleeding events. So I think that's the strategy. The key takeaway message is, I think, for the pharmacists, again, is one, make sure the dose is correct. Two, if there is a dose adjustment, make sure it's consistent with what has been studied or in the package labeling so that we're not putting patients at risk. And then finally, three, make sure people are persistent on their medication. The only way you're going to be successful is this is not a horse race, it's a long-term strategy, and you got to be at it every day. And there's little things that derail patients. I take medications every day, and I can tell you there's little things that disrupt my patterns in the course of a day that impact my medication prescription. So I think that's the key takeaway messages for our pharmacists.